I am privileged to welcome you all. The title of the session is Food Policy for Nutrition and Health. It's to improve the diet, the nutrition and health of the population of a nation by promoting healthy and adequate eating habit, food and nutrition surveillance, and the prevention and comprehensive care of diseases related to food and nutrition. So now I am requesting Sigrid to share her presentation.
Taking you from the continent of Africa to the continent of Asia, and especially to the modernizing and rapidly urbanizing context of Hanoi, the capital of Vietnam. And in this context, it's that we study the combined issue of food safety and nutrition for the urban poor. So let's first have a look at the Vietnamese diet. The Vietnamese cuisine is generally considered a healthy cuisine, and vegetables are not only preferably consumed every day, but even every meal. Unfortunately, food safety has become a prominent and mounting issue, and this quote actually really illustrates the dilemma of consumers and policymakers that it's important to eat nutritious, but what's the point when it's not safe for consumption? So these food safety concerns are driving supermarket development. Especially city authorities, they stimulate modern supermarket development and they reduce the traditional vending structures such as wet markets. Now the expectation is that private standards from supermarkets will ensure hygiene and food safety. But what about the urban poor? In Hanoi, over 40% of the urban population can be considered to live below the poverty line. And this population is also micronutrient deficient, and especially vitamin A and iron are prevalent deficiencies. So we really investigated the impact of food safety-driven policy, like supermarketization, on the diets of these urban poor. Now, and we did this by taking a social practices approach, really looking at the everyday ways of going about food of people. So shopping and eating within the broader routines of everyday life. And how did we do this? Actually, we focused our research on dietary intake as an outcome variable. So dietary intake, we thought, is depending on food shopping practices, since most foods are consumed in home. And food shopping practices are then depending on the food retail environment, read also the supermarketization policy, and the changing lifestyles of consumers, nuclear families instead of multi-generational families, and women working. So our research is still ongoing, and I will highlight some aspects which we researched in 2017, our quantitative research, while we currently also are conducting more in-depth qualitative research. What we studied first is actually the food retail provisioning, and we did a census where we mapped all the food retail outlets in 2 districts of a city along predefined characteristic typologies of retail outlets. And then with this mapping, we also added information on the assortment on offer. So both the level of processing, the nutrition content of the food, as well as the food safety claims available. We complemented this with price data on a basket of vegetables. Next, we conducted a household survey, which delivered data on the food shopping practices and the preferences, so food selection. And this included also socio-demographics as well as food safety, risk and trust perceptions. We then also really looked at food risk and trust perceptions in making choices in daily foods. And next, we also did a quantitative interactive 24-hour diet recall, which we adjusted for the Vietnamese context, and we also added the source of all the ingredients consumed. So we could triangulate this also with the food shopping practices survey as well as with the food retail environment. Now I will highlight some results. So first of all, our census really captured the diversity in different food retail outlets. And actually we made a simple distinction between formal and more informal vending structures, because we captured both, in which formal vending is licensed business and informal vending is more self-organized, unlicensed business. And then we also made a distinction between more modern and more traditional outlets, since that is the focus of the policymakers. And it's actually quite apparent that the policy is really one-dimensionally focusing on reducing markets and stimulating supermarkets. So given this policy focus, we really use this also for our stratified sampling, because both the household survey as the of the 24-hour diet recall and later on also our multi-generation interviews are really focusing on 4 strata. And those are defined by having outlets within walking distance. So the first group is the group that has and a supermarket and a wet market within walking distance. The second one only a supermarket. The third one only a wet market. And the fourth one has not a supermarket and not a wet market within walking distance. And here you see an example of the mapping which we use with all the different outlets to go street by street for this sample inclusion. So what we found, however, that we expected that there would be differences given the different retail environments, but actually the dietary intake across all those 4 groups was similar, and all women had a minimal level of diet quality. So what explains then this similar dietary intake, and actually that is the similar patterns across the different strata in food shopping practices. So we see that the dominant food shopping practice is everyday early morning shopping at a nearby market on food. And this means that the retail proximity really influences the food shopping, but it does not include the supermarket. So when people have a wet market within walking distance, they will go there, and if not, they will go to an informal market. So if these supermarkets are not in play, then we wondered, is this a budgetary issue? So we also measured that 44% of the income is on average spent on food. So what does this mean actually in terms of quality, affordability? And then we zoomed in deeper on the vegetable category. Measuring the prices across different channels of a basket of 20 commonly consumed vegetables, we noted that actually the quality related to food safety is best maintained in supermarkets and in specialty safe food shops. But however, the price differences are significant. What we found is that a 35% higher price for vegetables in supermarkets compared to markets was still affordable. But however, when you go to specialty stores, there was a double the price of wet markets, and this became unaffordable for the urban poor. Next, we also looked at the shopping baskets. What do they shop where? And what we found that indeed people really purchased their foods from the market, but also the most healthy foods were purchased there. So 70% was coming from markets and only 7% of the ultra-processed foods. When we looked at the supermarkets and the convenience stores, we saw actually the opposite, that only 19% of the foods are purchased in those outlets, but they contribute to 84% of the total amount spent foods in the ultra-processed category. So that leaves that actually the urban poor are really depending for their nutrition on the informal markets and the formal wet markets. And this is actually quite an important message, because our research demonstrates how ideal type supermarketization policies, when effectively enforced, so that they really reduce the markets and the street markets, might jeopardize the dietary quality of the urban poor in 2 ways. Actually, they might stimulate less healthy diets, consuming more ultra-processed food, or depriving those populations from nutritious food. Now, in this study actually unpacks the competing priorities between nutrition and food safety in governing food security. And this is really important because policymakers are really now focusing on food safety, but they should really include also and consider this nutrition aspect. And that's what we try to voice in our research. So to go further in depth with our research, we are now also conducting multi-generation interviews. It is currently ongoing, where we want to see change over time, as well as roles within family households and also learned practices. We are also capturing the daily lives of peoples and their whereabouts with food in a documentary that we also will share with policymakers in a policy workshop. And we already have a deal with the Ministry of Agriculture to share our results, because this ministry is also really troubled and worrying, how do we solve this problem? They also don't know, and they are very open actually to receive all the research results.